your advice for how to get these people to potentially go into therapy is to, to listen to them, to be patient, and, to be considerate of their needs. And I wonder if that's just really hard, if that's the place that the relationship's in, that they're really fighting to go into therapy.
Oh
Like,
yeah.
I imagine that you don't pivot from like having an argument for if you can go into therapy or not, and then all of a sudden there's this soft consideration for their for their feelings. That's a challenging road to go down. Have you seen it be helpful?
I have seen it be helpful, but your point is well taken. It's like, yeah, often when they're at that point, that's why I'm saying, well, the ultimatum approach also has its place, for someone
Right,
to say, I wish we could talk about this. Again, I can imagine even offering some understanding and still giving the ultimatum, It's like,
right.
well, I can see why you're reluctant, but we are at a place where I don't see another way forward. And so
I heard. I was going to say I heard on another podcast. I'm not sure where, but they say that like most couples therapy fails couples, and not because the therapy isn't helpful. It's because they go too late. Would you agree with that as well?
well, I would first quibble a little with the definition of fails.
Okay.
And actually, I do address this in my book. I think it's in the second book, in It's Not About Communication, that one. I address that issue. How do you decide whether therapy has actually been helpful or not? And folks who will say, well, I have a success rate of whatever. I'm always rather suspicious of those numbers, by the way. But if they're defining success as the couple stays together, okay, I often will tell people I have a bias in doing this work. It's a bias. It's not something that I want to impose on someone else, but I like to disclose it because my bias is toward helping people stay together if they want to.
Right.
I say that in a context where lots of couples therapists, if you really ask or observe, seem to have the opposite bias. And lots of individual therapists will have the opposite bias, where they'll say, well, if you're not happy, you should split up. And I don't come from that. Again, I keep calling it a bias because it's not determinative. It's like not up to me to tell people what to do. But that's my bias. Having said that, I've worked with lots of couples where my view of whether it was successful or not is that, oh, yeah, this clearly was successful and they split up.
Right.
Or my view is that, oh, this clearly was not terribly successful and they stayed together. Do you know what I mean? Those things aren't perfectly correlated.
Okay.
A couple stays together and is happy about it. Well, yes, that feels successful to me, certainly. But, when you're doing couples therapy, there are three people involved in deciding if it's successful or not. The couple and me as the therapist, and my opinion should count the least of those three. But I've had lots of situations where we've had three separate opinions of that, where, the one of the couple is feeling like, yeah, this is just what we need. The other couple is feeling like this is making things worse, not better. And I'm
Right.
sitting there thinking, gee, I'm not sure one way or the other.
Right.
So, that was my first answer, is to quibble a little bit with the definition of success. Now, having said the other part of what you said is so often quoted, especially from John Gottman. You've probably heard of John Gottman, and
Oh yeah, maybe that's where I've heard it.
you may have heard of. Yes, he often loves to quote this particular statistic, which is I think it's quite valid, although I've often quibbled with his particular use of this one study. He found a study. I actually looked it up. It took me a while to find it. It was a study that was done, I think, somebody's master's thesis in the early 1990s. And they asked people, how long have you had this problem before you sought therapy? And the average answer, and I forgot what it was, something like 7 years, something like that.
Wow.
And so John Gottman always likes to point out, look, if you had a broken leg and you didn't show up in the emergency room until, 6 weeks later, they would be saying, well, gee, it's awfully hard to set this and make it go right. You should have come in right away, and people don't do that with couples therapy. So certainly the idea, and lots of people will tell me, because I'll often say, why are you doing this now as opposed to 6 months ago or 6 months from now? Was there some precipitating event? And many, many people will say, oh, we should have done this years ago. So that's certainly true.
Right.
That particular statistic, I think, is making an awful lot out of one little finding, and I have no idea what people would say, because sometimes you don't know. You don't realize until you realize it.
Right.
And then, with hindsight, you see you were having problems, but you may not realize it until some event happens.